Have you ever wondered why diabetes care is so crucial for those living with the disease? In the journey of understanding this, let's first break down what diabetes is and the different types that exist. Diabetes is a chronic health condition that affects the way the body processes blood sugar, also known as glucose. It's like a silent invader, disrupting the harmony of your body's crucial systems. There are several types of diabetes, but for today, we'll focus on the two most common types: Type 1 and Type 2. Type 1 diabetes, often diagnosed in childhood, is an autoimmune condition where the body's own immune system attacks and destroys the insulin-producing cells in the pancreas. Think of it as a miscommunication in your body's defense system, leading to a lack of insulin, the key player in regulating our blood sugar. On the other hand, Type 2 diabetes usually develops later in life. In this case, the body either becomes resistant to insulin or doesn't produce enough. Imagine your body's cells like doors, and insulin is the key to open them. In Type 2 diabetes, the keys are either lost or not working well, leading to an accumulation of sugar in your bloodstream. Now you might wonder, why is managing blood sugar levels so important? Well, too much sugar in the bloodstream can lead to a myriad of complications. It's like a river overflowing its banks, causing damage to the surrounding areas. High blood sugar levels can damage nerves, kidneys, eyes, and heart, affecting one's overall health and well-being. This is why understanding diabetes and its management is not just crucial, but life-saving. For those living with diabetes, every day calls for a balance of food, physical activity, and medication to keep blood sugar levels in check. So now that we've understood what diabetes is and why it's so essential to manage blood sugar levels, let's dive into the steps on how to care for someone living with this condition. Because in the end, it's not just about managing a disease, it's about living a healthy, fulfilling life amidst it. The first step in diabetes care is monitoring blood sugar levels. But how do we do that effectively? Well, it starts with understanding the importance of regular blood sugar testing. This is not just a one-time thing, but a consistent daily routine. It's a bit like checking the weather before you leave your house. You wouldn't want to get caught in a storm without an umbrella, would you? Similarly, knowing your blood sugar levels helps you make informed decisions about your diet, activity level, and medication. Now, the tool most commonly used for this is a glucometer. This small handheld device measures the amount of glucose in your blood. It's a simple process. You prick your finger with a tiny needle provided with the device, place a drop of blood on a test strip, and insert it into the glucometer. The device then calculates your blood sugar level. It's quick, it's easy, and it can be done anywhere. But what does the number on the screen mean? Well, normal blood sugar levels typically range between 70 to 100 milligrams per deciliter before meals, and less than 140 milligrams per deciliter 2 hours after eating. However, these values can vary depending on the individual, so it's important to consult with a healthcare professional to understand what your target range should be, and what happens if your blood sugar level is consistently high or low. If left unchecked, both can lead to serious health complications. That's why it's crucial to seek medical help if you notice any significant changes in your readings. Remember, it's always better to be safe than sorry. So there you have it. Monitoring blood sugar levels is a fundamental part of managing diabetes. It's like having a roadmap that guides you through your journey, helping you navigate the twists and turns along the way. Because at the end of the day, it's not just about managing a condition, it's about living your life to the fullest. Monitoring blood sugar levels is the first step, but what you eat is equally important. How can diet and nutrition impact diabetes management? Let's find out. When navigating the world of diabetes, a balanced diet is of paramount importance. It's about more than just avoiding sugary snacks and drinks. It's about understanding the composition of your meals and snacks, and making conscious choices that benefit your body. A balanced diet for individuals with diabetes focuses on foods with a low glycemic index. But you might be wondering, what is the glycemic index? Simply put, it's a scale that ranks carbohydrate-containing foods by how much they raise blood sugar levels. Foods with a low glycemic index are digested and absorbed at a slower rate, leading to a more gradual rise in blood sugar levels. These include foods like whole grains, legumes, fruits, and vegetables. But remember, it's not just about what you eat, but also how much you eat. Portion control is key. Overeating, even of healthy foods, can lead to weight gain and higher blood sugar levels. Here's a handy tip. Try using smaller plates and bowls to help manage portion sizes. Moreover, regular meals are vital. Skipping meals or going for long periods without eating can cause blood sugar levels to fluctuate. This inconsistency can make diabetes harder to manage. Aim for consistency in meal times and try to incorporate a balance of proteins, fats, and carbohydrates in each meal. Hydration is another crucial aspect of diet and nutrition. Water is the best choice as it doesn't raise your blood sugar levels. Avoid drinks that are high in sugar and caffeine, as these can lead to dehydration and fluctuating blood sugar levels. In essence, managing diabetes through diet isn't about radical changes or deprivation. It's about balance and consistency. It's about understanding your body's needs and responding to them in a mindful, nourishing way. And while a balanced diet is essential to diabetes management, it's not the only factor. There's another important piece to this puzzle, and that's physical activity. But we'll delve into that in the next segment. A balanced diet is essential, but there's another piece to this puzzle: physical activity.
Scene script. Physical activity is often underrated when it comes to diabetes care. Let's change that. Regular exercise is like a secret weapon in the battle against diabetes. It's a potent tool that not only helps in maintaining healthy blood sugar levels, but also improves overall health and well-being. But how does it do that? Well, when you exercise, your muscles use sugar for energy, which naturally brings down the sugar levels in your blood. Isn't that fascinating? Now you might be wondering, what kind of exercise should you be doing? The good news is that there is no one-size-fits-all approach here. The key is to find activities that you enjoy and can stick with over time. For younger individuals or those with a fairly active lifestyle, aerobic exercises like brisk walking, running, or cycling can be great options. These activities not only help control blood sugar but also boost heart health. For older adults or those with physical limitations, low-impact activities like swimming, yoga, or even chair exercises can be beneficial. Remember, the goal is not to become a marathon runner overnight, but to incorporate some form of physical activity into your daily routine. And let's not forget about strength training. Lifting weights or doing body weight exercises can help increase muscle mass, which in turn helps your body use insulin more efficiently. Just make sure to consult with a healthcare professional before starting any new exercise regimen. But exercise is not a replacement for a healthy diet or medication. It's a part of the whole package. Think of it like a tripod, with diet, medication, and exercise as its three legs. You need all three for it to stand. So lace up those sneakers, dive into that pool, or unroll that yoga mat. Because when it comes to managing diabetes, every step, every stroke, and every stretch counts. Regular exercise is a must, but there's one more thing that ties everything together: medication. Medication and regular checkups play a vital role in diabetes care. Let's explore why. Diabetes management is a delicate balance, and medication often becomes an integral part of this journey. These medications might come in the form of pills, injections, or even insulin, depending on the type and severity of the diabetes. The purpose of these medications is to help regulate blood sugar levels, ensuring they stay within a healthy range. But why is medication so crucial, you might wonder? Well, when the body fails to produce or properly use insulin, blood sugar levels can rise dangerously high. These medications help the body to either produce more insulin, use it more effectively, or sometimes even do both. This tight control of blood sugar levels is what helps to prevent or manage the complications associated with diabetes. However, medication alone isn't enough. Regular doctor visits and routine tests are equally important. These checkups allow your healthcare provider to monitor your progress, adjust your treatment plan if necessary, and catch any potential complications early on. It's not just about ticking a box, it's about proactive health management. Routine tests might include regular blood sugar tests, A1C levels, kidney function, cholesterol levels, and eye exams, among others. These tests provide a comprehensive view of how well diabetes is being managed and what changes, if any, are needed. Remember, every person with diabetes is unique, and what works for one might not work for another. That's why it's essential to work closely with your healthcare team, keep them informed of any changes, and follow their advice diligently. In conclusion, medication and regular checkups are not just about managing diabetes. They are about empowering individuals to live their best, healthiest lives. They are the tools that enable those living with diabetes to take control of their condition and live life on their own terms. Remember, caring for someone with diabetes involves monitoring blood sugar, maintaining a balanced diet,
regular exercise, and staying on top of medication and checkups.
Now that we've covered the basics of diabetes care, let's summarize. First, we had a deep dive into understanding diabetes. Then we explored how crucial it is to monitor blood sugar levels. We also discussed how diet and nutrition play a vital role in managing this condition. We emphasized the importance of physical activity and underscored the need for medication and regular checkups. With these steps, you can ensure the best care for someone living with diabetes. Remember, every step counts towards a healthier life.